for being here, appropriately social distanced. Today's day 220, believe it or not. Local governments need to assign people to a state enforcement task force because I want to make sure that that is happening. New York City must provide 400 personnel to the New York State Task Force. I want to thank our government partners in this cluster initiative. I've spoken to many of them myself today, but we have in Binghamton, Broome, Jason Garner has been very helpful, Stephen Newhouse in Orange, Ed Day in Rockland County. We spoke through some issues today. I want to thank him very much for his cooperation. New York City we've been working with, Laura Curran in Nassau we've been working with. Together we're going to get this done. It's not easy, but we know where the cases are and we know what we have to do. So government has to do its job, but individuals have to do their job also. And organizations have to do their job also. We're all citizens, and it's not government's job to catch you. It's the citizen's obligation to do the right thing, right? You don't speed on the road, not just because you're afraid to get a ticket. You don't speed because you don't want to kill anyone, right? You act responsibly with COVID because you want to protect yourself, you want to protect your family, you want to protect other people. And organizations have to do the same thing. I am informing all houses of worship today. Obviously, these rules, the new rules, are most impactful on houses of worship because this virus is not coming from non-essential businesses. That's not what this is about. It may be spread by non-essential businesses. The virus is not starting in schools. It may be spread by schools. This is about mass gatherings. This is about mass gatherings. And one of the prime places of mass gatherings are houses of worship. I understand it's a sensitive topic, but that is the truth. We see clusters now across the state, colleges upstate. We have a cluster in Binghamton, Orange, Rockland, Queens, Brooklyn, Nassau. The cluster is just that. It's a cluster of cases, a high density of cases. And it seeps, it grows from that cluster almost in concentric circles. You drop a pebble into the pond. Pebble goes in, then there's one ring, two rings, three rings, and the rings continue across the pond. That's how the virus spreads. When you see the cluster, you have to stop it at that point. What's our strategy? Crush the cluster and stop the spread. And we're announcing a special initiative to do just that, the Cluster Action Initiative. Catchy name. Step one, you take the most dramatic action within the cluster itself, where you have the highest density of cases. Understanding that the people in that cluster interface with the surrounding communities, take additional action in the community surrounding the cluster, and then on a precautionary measure, take action in the communities that are outlying that area, right? So 3 steps. First, identify the cluster. You can identify the cluster because we do so much testing and we have so much data. We can tell you where there is a cluster by the actual number of cases. We have the addresses of people who are COVID positive. So we have mapping software where you can see exactly where the cluster is. That's the highest density of cases. That's where you have to take the most dramatic action. The surrounding area is where that cluster is going to seep. Why? Because that's where people interact in the grocery store. That's where they interact at the bus stop. That's where they interact in the local recreational areas. So cluster, the area around the cluster, and then as a precautionary measure, the area around that. That's how you attack a cluster. Most intense action on the cluster itself, and then precautionary action as you pull back. Clusters, all of these areas, you can look at them exactly by the cases. It's not by zip code, it's not by census tract, it's not by any political metric, it's only by the number of cases. So for example, Brooklyn, New York, we have one area, and this is an actual map of Brooklyn. The cluster is the red area. That is the area in, this is basically South Brooklyn, that has the highest number of cases by actual data. The surrounding area, orange, if that's really orange, it's more like a brownish, but that is the second ring, right? That's the warning area, because the people who are in that cluster, they're going to the same store, they're going to the same church, they're going to the same bus stop as people in that surrounding area, right? There are no walls here. The third area is the yellowish area around the perimeter, from that line, straight line down. That we call a precautionary area, okay? Because they may very well also be coming in contact with the people in the cluster. Or the people in the middle of that cluster may have infected somebody in the orange zone who may be in contact with someone on the yellow zone, right? It goes, red is the cluster, orange is surrounding the cluster, yellow is the periphery. So that's the actual South Brooklyn map. Queens, there are two areas that will be mapped just the way Brooklyn is mapped, but same concept. There's a central cluster, there's a surrounding area, and there's a precautionary area surrounding that. Two smaller areas in Queens. The Brooklyn area is larger than either of the two Queens areas. Binghamton, we have a cluster. Binghamton, we're declaring a yellow zone, which is the precautionary zone, which is a less intense action plan than in a red zone. Why? Because there's just fewer number of cases in Binghamton. The density is less, the cluster is less, but it still requires precaution. Orange County, we have an intense cluster, and then what we call a precautionary zone around that cluster. Rockland County, same thing. We have an intense cluster, and then we're establishing a precautionary zone around that cluster. These are relatively small areas geographically. Maybe a cluster is 1 mile in diameter. Maybe with the orange warning area, it's 1.5 miles. Maybe with the precaution area, it's about 2 miles. So these are geographically circumscribed, relatively small, but that's why they're clusters. And the trick is to keep it small, right? Keep the infection from spreading. So small but intense targeted efforts in that area. And we have new rules for a red, orange, or yellow community. The red, which is the most impacted area, houses of worship will be 25% capacity, up to 10 people maximum. So if it's a church or a mosque or a temple, there'll be a maximum of 25% capacity or 10 people. No mass gatherings, only essential businesses open, only takeout dining, and schools are closed. In the orange areas, that's the second ring, houses of worship, 33% capacity, 25 people maximum. Mass gatherings, 10 people maximum, indoor or outdoor. Businesses, we close high-risk, non-essential businesses. High-risk are defined businesses like gyms, personal care, et cetera. Dining, no indoor dining, outdoor dining only, 4 people per table. Yellow, which is the precautionary zone, 50% capacity in a house of worship. Mass gatherings, 25 people. Businesses are open, dining, indoor and outdoor, but 4 people maximum per table. Also, the schools in the yellow area, public or private, must do mandatory weekly testing. The schools and the students are people who are very likely to interact with people within that community. And we saw this in New Rochelle. All the kids go to different schools, I know, but they meet in the playground, or they're on the Little League team, or they're on the period. You want to solve the problem? Acknowledge the problem. Deny the problem, look at a red herring, and then the problem gets worse. The problem is mass gatherings and houses of worship, colleges, and some miscellaneous foolish behavior in bars, outdoor venues, etc. I spoke to members of the Orthodox Jewish community today. I spoke to the leaders myself this morning. We had a very good conversation. These rules will apply to all houses of worship. Many of these communities have a large Orthodox population. I have been very close to the Orthodox community for many years. I understand the imposition this is going to place on them. And I said to them, I need their cooperation. I need their partnership. They're very cohesive communities. And I asked for them to work with me to follow these guidelines. And that was positively received. I said to them that I'm doing this for a very simple reason, because I have such respect and love for the Orthodox community. I have been friends with them all my life, and my father before me, by the way. We go way back, and it's out of respect and it's out of love, and it's because I want to protect them. In Jewish teaching, one of the most precious principles is saving a life, to save a life. The Torah speaks about how certain religious obligations can be excused if you are going to save a life. This is about saving a life. That's what this is. No large gatherings in synagogues, to save a life. You look at where the infection rate is. You look at those clusters. People will die in those clusters. And this is about protecting people and saving lives. And I felt very good about my conversation with the Orthodox community. And I thank them for their help and their cooperation. Seasons change, circumstances change. and we change with it. That's what we do. This is not a New York State phenomenon. You look at what's happening even in our region of the country. New York is